Welcome to our Women's Health Wednesday segment where we talk about the health topics that matter most to women at every stage of life. Today, we're talking about a condition that's incredibly common and, like many, commonly misunderstood. Bacterial vaginosis, also known as BV, and here to break it down for us is Larissa Savage, a labor and delivery nurse and certified nurse midwife at Carle Health's OBGYN clinic. Welcome back.
Thank you.
It's been a while since we've seen you.
I know.
Glad to have you here. So, BV, let's start off with the basis. What exactly is it?
Sure. So, admittedly, this is not the cutest topic, but like you said, it's so common. So typically, this is something we notice with our vaginal health. So usually odor is by far the most common symptom that women will describe. It'll be like a fishy odor. I know, gross, but if you've smelt it, you've probably experienced that. And then typically there's discharge. It could be gray, white, yellow, green. It can be a kind of a mixture of things. Sometimes it's irritating. Again, I would say the odor is by far the most bothersome.
So how do you differentiate that from a UTI or a yeast infection?
Sure. So I would say more of that discharge. So yes, kind of all of it goes together. So when you come to see us, if you've never had this before, we're usually looking for all of that. We're going to look for a yeast infection, we're going to look for bacterial vaginosis, and we'll rule out a UTI because we don't want to just throw antibiotics at something if we don't know what we're treating.
And speaking of UTIs, I mean, is BV something that's sexually transmitted, or how exactly do you get it?
Sure. So this is actually like a really hot topic and has changed just this upcoming year. So bacterial vaginosis has never been listed as a sexually transmitted infection. However, we're realizing that it can be transmitted through like sexual intercourse. So ultimately BV is when the pH, so your vaginal pH shifts, and so the bad bacteria outweighs the good bacteria. But what now we're seeing is if we're exposed to that with a sexual encounter, sometimes we can pass it back and forth from partner to partner, but it's still not considered like a sexually transmitted infection, but we can treat both parties.
I mean, it sounds like one. I don't understand why it's not considered.
I know, it just hasn't fallen under that category yet. So basically, yes, we can treat it, but really most women who do have BV, it's because of things that they unintentionally expose their own vaginal microbiome to. So I like to say, like, the vagina has its own ecosystem.
I've heard that before.
Yes, so that's why women are really into probiotics right now. They want to feed the good bacteria of their vagina so that we prevent infection. But if we overwash, if we introduce too much soap, if we use laundry detergent with too much ingredients or fragrances, we can actually cause bacterial vaginosis because of that exposure.
And speaking of that, I know some people, when they wash, they go in and wash. But with it having its own ecosystem, that's not necessarily necessary.
So I tell women in the office, I want you to get a plain bar of Dove soap with no fragrances, nothing on it, and it's only for your lady parts.
Okay.
And you do not go inside. It's only on the outside. So we don't need to put soap down there. It's going to clean itself, and if we remove all of that good bacteria, then it can't fight off our bad bacteria.
Now, one more question about transmission before we move on, because I don't want to get stuck on that. So it can be transmitted partner to partner, but is it one of those infections that only affects women and men can just transmit it, or is it something that plays a part in their health too?
You're going to see it more with women. You're just going to see it more often because of that discharge and the odor. We don't see that as often with men in general.
Yeah, and outside of just washing outside and not going in, are there any other lifestyle changes people should be aware of?
Sure. So sleeping in cotton underwear or no underwear at all, so letting things air out basically. Looking at like what soaps do you use? Do they have fragrances? Do you use lubricants with different fragrances and smells? There's a lot of stuff at the store where you'll go down the aisle and it'll say this will make your vagina smell good. It won't. It will give you BV. Just leave it alone.
It's not funny.
Don't take it. Seriously, that's what causes it.
Yeah, okay, so let's say you have it.
Yeah.
Or you have discharge and you go and get seen.
Yes.
What does the treatment look like?
So there's typically two treatment options. One would be an oral antibiotic. Typically, we can't drink alcohol on this, so I do kind of, patients don't always want to do that. And then there's also a gel insert. Some people just prefer to insert the gel or that antibiotic gel directly into the vagina. So either or, it just depends on patient preference.
So the insert, is that similar to Monistat?
Yes, so it like comes in that applicator and you insert it in, and it's usually just a couple of nights. Yep.
Okay, well, when should someone come and see you all versus try to figure things out on their own?
Sure. So I always warn patients, like when we're in these hot, moist environments, especially during the summer, we're going to have like a BO odor, right? We're going to smell maybe a little bit stinky. That's very different than a fish-like smell. So it's when these symptoms become bothersome, when maybe you've started to notice it, maybe during intercourse you're noticing pain or weird pressure down there. That's when we would want you to come in and see us. Because there's a difference. So know that if it smells like your armpit, it's probably just us being sweaty because it's a crevice of our body. But if it's starting to have that fish-like odor and it's starting to bother you, please come in and be seen.
And is BV something that's reoccurring?
It can be. So there's other things that we can do. So we usually say if you've had a positive test twice or 3 times in the last 6 months, we want to come up with a plan with you for how we can prevent it from reoccurring. Whether that's maybe we try a different type of antibiotic, maybe we treat your partner if we haven't done that already, or we do something preventatively to try to keep it from coming back. And sometimes it's talking through those hygiene steps. What have you been doing? What do you wash with? What detergent do you use? Do you use dryer sheets? Stuff like that. It's as simple as that sometimes.
Oh my goodness, so insightful. And of course, if they have more questions, they can reach out to all of the health experts at Carle Clinic's OBGYN.
Absolutely.